Chloe Dalton.
Mm-hmm.
How are you doing today?
I'm good. How are you?
Doing good, thank you. Do you mind if I call you Chloe?
Yes, ma'am.
Alright. My name is Kristen. I'm a student physical therapist at Anderson University. I'm going to be working with you today doing an abdominal exam.
Mm-hmm.
And all this is I'm going to be looking at areas of your stomach as well as listening and feeling around your stomach if that's okay with you.
Yeah.
Good. If you have any pain at any point, let me know. Before we get started, do you need to use the restroom or anything? Alright, you can go ahead and lay on your back for me. And whatever's more comfortable, you can have your knees bent or have them straight. Yeah, go ahead and slide this up. Good. Alright. So the first part of this, I'm just going to be looking around, inspecting the stomach. I'm looking for things such as masses, any pulsations, bruising, differences between the right and left side, possible hernias, but everything looks good. We're going to move on to the next. I'm going to warm my hands up, Chloe, but the next part I'm just going to be listening to different areas of your stomach, and you just relax for me, okay?
Okay.
Alright. So for this, I just listen to each of the 4 quadrants. And I'm just listening for any bowel sounds. And it's normal to hear bowel sounds in each quadrant, which I do. That's good. This next part, Chloe, I'm just going to be tapping different areas of your stomach. Shouldn't be painful, but let me know if you do have any pain, okay? So for this, I just percuss in each of the 4 quadrants. And I'm basically just listening for any different sounds, tympany and dullness. Most of the abdomen, I should be hearing tympany sounds because the organs are filled with air. If I do hear dullness, that's most likely because I'm on the liver, the spleen, or there might be fluid or a mass in the stomach, but everything sounded good. The next thing we're going to do is palpate for the liver and find the upper and lower borders of the liver. So Chloe, I'm just going to come right here. And I'm just going to start beside the umbilicus, going up the midclavicular line, listening for those contrast sounds. And right there is where I hear a change to a dull sound. So I'm just going to mark that. Good. And now I'm going to come to the upper border and do a similar thing. Start just above and work my way down in between each rib until I hear a change. So about right there. Good. And we just measure this border. And I'm getting about 8 centimeters, which is good. Sometimes people have an enlarged liver, and that's one way you can check, but that was normal. The next thing we're going to do is I'm just going to start doing some palpations. Chloe, I'm just going to have a little pressure in each area. Starting very light. You let me know if you have any pain. Starting in the right lower quadrant, some important structures here are going to be the appendix is like the main one, and then you have your colon, small intestine, and also your reproductive organs would be in this area, so any pain right there might indicate something's wrong with any of those areas. Moving up towards the right upper quadrant. We've already discussed this, but the liver is one of the main ones in this area. You also have your gallbladder, and part of your colon would also be in this area. Any pain with that, Chloe? Go into the left upper quadrant. Important things in this area would be the spleen, which is kind of more towards the side and up under the ribs. You don't usually feel that though. You also have your pancreas, the stomach, and part of the liver are some of the main structures, part of your colon as well. And then we're going to move down to the left lower quadrant. Things here mostly would be the colon, small intestine, and reproductive organs. Your kidneys are going to be in your upper quadrants, but they're more towards the posterior side, so we'll check for those at the end. Moving on though, I'm going to do a more deeper pressure, Chloe, and you let me know if anything hurts, okay? So while I'm in this right lower quadrant, I'm going to go ahead and check McBurney's point. So I find her ASIS in her umbilicus. Go about a third the way up. Chloe, you're going to feel a deep pressure. And then I do a quick release. Any pain with that? Okay, if she had any pain with the rebound tenderness, that might indicate appendicitis, which that was good. Moving up to the right upper quadrant. More deeper pressure, any pain. I'm going to go ahead and check Murphy's sign here, which is where I've already marked the lower border of the liver here, which would be where the gallbladder would be. Chloe, if you want to exhale for me, I'm going to do a little deep pressure. Alright, now do a deep inhale. Good. Any pain with that?
No.
If she did have any pain, that would be a positive sign. Might indicate inflamed gallbladder or gallstones or cholecystitis. That was good. Moving over to the left upper quadrant. Any pain with that? Good. In the left lower quadrant. Any pain there? Alright. I'm going to next palpate for the abdominal aorta. So for this one, I kind of follow right above the umbilicus here and then go just left of that. And I'm feeling for a pulsating mass here. Or not mass, but pulsation. I feel it about right there. Mark that. And then I'm going to come towards the right side of that. And again, feel for pulsation. Try to track the border. And I get it about right there. And then measuring that, I'm getting 2 centimeters, maybe a little more, and that's normal. Anything above 3 centimeters would indicate possible aortic aneurysm, abdominal aortic aneurysm, so that was okay. Any pain with any of that? Alright, I'm going to do a couple special tests, Chloe, and then we'll have you sit up and check your kidneys, and we'll be done, okay? Alright, the last few tests I have are going to be for appendicitis as well. So the first one we're going to do is the psoas sign. So Chloe, if you'll try to resist my hand and bring your leg up. Okay? Any pain with that? No. If there was pain at McBurney's point, that could be a possible sign of appendicitis. We're going to do the obturator sign. So we have our knee and hip bent to 90 degrees. I'm going to passively take it into internal rotation. Any pain with that?
No.
Okay. Again, the appendix lives near the obturator muscles or in the psoas, so any of that would cause irritation to the appendix and cause pain. The last test we have for appendix is Rovsing sign. So we're going to be in her left lower quadrant, and I'm on her right side, and I'm going to apply some pressure, Chloe. Any pain?
Mm-mm.
And then a quick release. Any kind of rebound tenderness that referred back to McBurney's point might also indicate appendicitis or peritonitis, but that was good. Alright. If you don't mind, Chloe, that's all we have while you're on your back. You'll sit up for me, and then I'm just going to bring your shirt up. The last thing we're going to check for is the kidneys, so I palpate her costovertebral angle, tracking her ribs. It's about right here. We're just going to percuss on the right and left side. Any pain with that?
No.
How about there?
Mm-mm.
Alright, if she did have any pain, that would be possibility for any inflammation of the kidneys, but she was good. Chloe, do you have any questions for me?
No, I'm good.
Alright, well, it was a pleasure working with you, and I'll see you next time, alright?